Hi guys, this is Kristopher with Pacific Sound Plastic Surgery. I made an illustration here so we can talk about frontal bone contouring for facial feminization. So one of the most common questions that we get when we are talking in a patient's consultation about facial feminization surgery is, what is it we're really doing? What are all the options? There are many, and the facial feminization consultation is one of the more complex because sometimes this can involve the forehead, sometimes this can involve the nose, the jaw, the chin, or combinations thereof. There's also soft tissue considerations on the lip, the height of the lip, and the cheeks, for example, which can sometimes involve implants or even facial fat grafting. One of the most common bony level contouring procedures that's done, however, is in the forehead. So frontal bone contouring, which is a craniofacial procedure. So what are we doing when we're contouring the bone is usually we're removing the glabella or the frontal bone, the embossment here. It's really the connection between the muscle that goes up and down in your forehead called the frontalis. Anytime there's a bony connection of a muscle, that is going to hypertrophy that bone or cause it to grow because that muscle attachment needs something to attach to. When it's repeatedly pulling on that muscle, there's also a principle called Virchow that will make that bone grow, get bigger, the cells proliferate. Basically, they're responding to a stress, right? So in a large muscular masculine forehead with a large frontalis muscle, there's a lot of pulling going on that frontal region. So that glabellar region is what's referred to as the lower portion of the forehead where that frontalis muscle connects. So how do we decrease that? A lot of people talk about levels 1, 2, and 3 frontal bone contouring or frontal reduction surgery, and those are valid, but sometimes you get caught up in the numbers. You don't really have to get caught up in the numbers. You can simply look at what it is we are doing. So the frontal bone is your forehead bone. It is also where the frontal sinus is attached or located between the anterior and the posterior table of the frontal bone. A sinus just means a cavity. We have cavities in our facial bones so we can help with things like resonance. It's a mucus-producing cave, essentially, that drains into the nose. In order to reduce this bone, we have to reduce it right over the frontal sinus, so we need to do something with the anterior frontal sinus table or layer, the anterior layer, the front layer that you feel and you see. So there's different things you can do with that. If it's not very prominent, you can just burr it down. And then if you don't go all the way to the frontal sinus, then that'll be sufficient reduction. Most people, they need more than that. If you have to actually remove the table, then you need to also put it back on and secure it. Usually that's after a combination of burring and taking that anterior table to actually the back table, the actual table in the operating room, and taking a tool that's not unlike a Dremel tool, or we can also use special bone benders that make what's called hesitation cuts or small fractures in that bone to go from a curvature structure to a more flat structure so that this anterior table frontal bone, this glabellar area, is less prominent. I often do this in combination, so it's both. We do virtual surgical planning in most cases where we look after a CT scan on a computer platform directly at this sinus, map out where it's located, and this is an actual 3D model used by for a recent forehead contouring case where we've done just that. So this green area is where the frontal sinus was. We map this out. We use a custom cutting guide, so an implant that actually goes right on the patient's actual forehead. We use that then as a marker. We make cuts in that bone along the periphery of that sinus, and then we can manipulate and take that anterior table off, flatten it out. But while it's off, we go on all these blue areas, for example, and we contour it down. Usually combination forehead contouring is done with superior orbit, so the masculine superior orbit is quite straight, flat, and lower, whereas a more feminine appearance is a higher arched superior orbit, so this is usually brought up to be more higher arched. And then sometimes, such as in this patient, there's lateral orbital bossing, so that was present here, and we just contour that down as well. Obviously, all these things are done with finesse, judgment, and artistry at some level. If you have, for example, a large bony ridge along the lateral sides of the frontal bone, that can be smoothed down, such as we did here. And sometimes there's frontal bossing of the bone. That's basically just a natural contour of the development. of that bone that we want to make softer. So we're making a lot of these contours softer. And then we bring that bone, put it back in place, and we have some sort of stabilization over it. I've learned from members of who are called the facial team in Spain, who do some of the highest volume of this work in the world. And they one of their providers likes to use a mesh, so I use a mesh. I've had good experience with that. We are also able to fill in any cracks. So when we take that bone off, we actually put the dust that is created when we take off the bone back in place over these cracks, and that mesh provides a nice scaffold to do that in my hands. You can also use just small stabilization plates. So in summary, that's what we're doing when we're talking about forehead reduction, which is the most common bony procedure in facial feminization surgery. We're talking about reduction of the glabellar prominence, where that big frontalis muscle has connected and caused bony enlargement. And we are talking about reduction or setback, usually of that anterior table, combined with contouring, which is why every case is interesting, every case is stimulating, fulfilling, and technical service that we deliver so that we can achieve patients' goals, and in this case, get them feeling more like themselves, which is a big deal to a lot of people. So that's facial feminization surgery, or one of the components of it, especially the forehead reduction component.